My name is Dr. Hardy Singh. I'm a shoulder specialist at Carolina Regional Orthopedics in Rocky Mount, North Carolina. I'm going to walk you through what happens when a new patient comes into my clinic on my day and what the flow of that patient is from A to Z, so to speak. So the patient checks into the front desk, a whole demographic sheet that they have to fill out. And we ask the patient what they are here for, what's the symptoms, what's the duration of the symptoms, what's bugging them, what's making them better, what have they tried to make themselves better before they saw us, was there a primary care doctor who referred them to us, and what was treated in the background in that particular clinic setting. So when the patient checks in, typically, and not every time, we might get an x-ray, because the x-ray gives us a good understanding of what the whole skeletal anatomy of that particular shoulder may be. Where is the ball related to the socket? Is there any fracture, any dislocation? Is there any half a dislocation called subluxation? We try to figure out from an x-ray, how's the overall alignment of the shoulder? And then the patient gets to see, after the x-ray, gets to see one of the specialists, either me or my partner or my PAs. And we go and do a thorough examination based on the symptoms. And about 15-20 minutes of appointment later, the patient either gets a diagnosis made, because we have an ultrasound machine in the clinic which also helps with us with our clinic diagnosis, and sometimes we order further studies like lab work, blood work, MRIs, EMG studies, CT scans, sometimes bone scans. So we try to get to the bottom of the problem if it needs more testing, or we may be diagnosing them at that particular visit, give them a diagnosis and give them a good full treatment plan as to how to move forward in the next few months for that particular problem. If you have any further questions about shoulder injury and how to see me, please call us and consult us at Carolina Regional Orthopedics.